Hello, I'm Caitlin McDonald, and welcome to the Social Speak Network podcast. Now, in this episode, we're going to shake things up a little bit. Last week, I know we did as well, but we're going to be jumping back into doing interviews next week for the next few weeks, and then integrating in kind of some overview recordings such as this one, as well as interviews. So just kind of going back and forth with Amber and myself, as well as those fantastic interviews that we have been doing. And who knows, maybe we'll put in some more advanced trainings in there as well, just like we did last week for the editorial calendar. So in this week's podcast, we're going to be talking about some of the key elements that our guests have brought up over the past month. I'm also going to be touching on some points that future interviews that we've already recorded but haven't published yet are going to be talking about in more detail, just so that you get a couple of teasers there. Next week, we have a great interview with a LinkedIn expert. And so she will be bringing up kind of what you can be doing in terms of having LinkedIn really work for your practice. And then the following week, we are having the owner and founder of Gold Medical Marketing on, and he has some incredible insights and really unique perspective on a lot of things that you're going to be dealing with when it comes to creating a marketing budget and really making sure that your messaging is resonating with your target market. But let's jump in with some real life things that you can be integrating in your marketing for your medical practice. So first things first, one of the big things that we've been talking about for the past month is really understanding your medical practice buyer persona. So rather than grouping all of your patients together, it's incredibly important to understand each of your specialties and the individual people who fit within those specialties. So let's say you work at an orthopedic center. A lot of the examples that we have been using and will continue to use have to do with orthopedic centers. But you can take this to, any medical practice as well. But let's say you're an orthopedic center and you specialize in joint pain and back pain as two of your key conditions. So who are the specific candidates that you can target for these specialties? Carr, who we had on a couple weeks ago, he's the CEO of Farotech, recommends thinking about what people are doing when they need your services. So for example, if a specialty of yours is shoulder pain, you could target baseball players, specifically pitchers. Or you could target somebody who does handiwork around the home and fell off a ladder. Each of these are going to have incredibly different journeys as they come to work with you and your practice. So what other services, another thing to think about is what other services are these people going to need? So which of those two examples should you target your marketing for? So if you treat the individual who fell off the ladder, they might not necessarily have other ailments. But if you treat the baseball player, and the next thing you know, maybe they're coming back for knee pain or back pain or other ailments that go hand in hand with continually using your body in a repetitive motion. So I'm not saying go out and make all your marketing for baseball players, but go through this exercise of really understanding who your target market is and their buyer persona, as well as their buyer journey. So the journey that they're taking, both emotional and physical, as they're deciding to come in and call you and work with your practice. So the exercise that we recommend doing to understand your buyer persona is to write a list, create a spreadsheet with all of your practice's specialties. So what patients typically come in for these, and what services may they need after the fact. So once you've completed the exercise, rank the specific buyer personas based on how, on both low-hanging fruit, or who will schedule a call quickly, as well as the typical customer lifetime value. So folks who often have more than one procedure once they schedule their appointment, for example. Then we also heard great advice from one of our first interviews with Abby Thompson of Salted Stone. And she recommends picking up the phone or hiring a company to pick up the phone and call up your patients. Now, by doing this, you actually get to see who's coming in. You get to have a friendly touch and get in front of them again. And you are able to actually review and create a tactical and strategic plan around the patients that had the best experiences, the patients that are planning on coming back in, and the patients who have already been in to see you multiple times. So actually picking up a phone and calling them or sending off a survey to your existing clients, again, make sure that you're HIPAA compliant, obviously, but by doing this, you are able to hear directly from the folks that are making a difference in your practice and understand who exactly you're attracting and who you want to be attracting. Then you can recreate your marketing message based on this. Now, I'm just going to bring up the interview that we have coming up here pretty soon. And the reason why I want to bring this up, and it's with Daniel Goldberg of Gold Medical Marketing. But one of the things that he brings up is how a marketing budget can be detrimental for your practice. And what he talks about, and again, this is in 2 weeks, but what he talks about is really thinking of your marketing budget as a moving target. If something's working, you want to put more money behind it. If something's not working, you want to stop putting money behind it. So by having a marketing budget and not necessarily reaching that end dollar amount or reaching it and needing to surpass it could reflect poorly on your department, and you're not taking in real-time information. So combining what he says with what Abby says at Salted Stone about reaching out to people and really talking with them and understanding what their journey has been allows you to create this moving budget that's going to allow you to see more leads coming in to best service the patients that you have and to create those educational resources. So back to this topic. So we have 3 tactics that I want to bring up today to integrate your patient journey into your digital marketing strategy. So the first tactic is to create interactive resources that speak to the main concerns, questions, and pain points of your niche target markets. So Abby Thompson started utilizing quizzes, ebooks, and interactive videos to draw prospects into her clients' practices. She used these to engage them and to increase the ROI of the marketing efforts. So to create these interactive elements for your own practice, focus your attention on answering the most daunting questions or concerns of your target market. Some ideas to think about could be a step-by-step guide to exercises to do at home to build strength prior to a surgery, or a video interview with a physician explaining the exact process used in the procedure. Capture the name and contact information of the individual interested in the resource and send them targeted information that brings them further along in the patient journey. Now, tactic number 2 is to build advertising campaigns that are specifically geared towards immediate leads and long-term brand recognition. So as mentioned, some of our prospects are ready to call your practice right away, whereas others might actually take a little bit of time to nurture. Daniel Goldberg, again, the founder of Gold Medical Marketing, tends to emphasize with his clients that you can't have the same goals for every marketing campaign. Some advertising campaigns should be designed to capture leads immediately, but others need to be more aligned with your patients' journeys. Your practice needs to build brand recognition and instill trust with prospects before they are ready to pick up their phone for that initial consultation. Here, specifically think about running display ads or retargeting campaigns to stay top of mind with prospects. Now, the third tactic is actually currently one of my favorites to implement for health centers. And this involves creating an in-depth FAQ section on your website to address both services and conditions. So both Chris Carr of Farotech and John McAlpin, the SEO director of Cardinal Digital, really emphasized and highlighted the importance of utilizing FAQ sections to interact with your buyer personas. So just as Abby Thompson and Daniel Goldman recommended paying attention to the key concerns, questions, and pain points of your target patients, creating an FAQ section on your site, or even an FAQ section on each specialty that you offer, can increase the effectiveness of your digital marketing strategy. So, why does this happen? There are a few different reasons, but first let's talk about things that you can do to make sure that the FAQ section is actually going to work for you, and then we'll get into those end benefits. So one thing that you can do when you're building out this FAQ section is create short videos. We've even recommended just using your iPhone for these videos, and answer each question that an individual might have. So just 15 to 30-second little videos, and then also have that written answer. So these videos can then be repurposed in so many different ways. So this is one of the benefits of having them. You can have them in targeted emails. Again, you're putting that face to the name and that persona or that personality of your physicians in front of your prospects. You can also share these online through social media or through other channels. And so as you map out the full buyer journey, each of these videos will serve a specific purpose. John McAlpin, on the other hand, uses and focuses on the technical aspects of search engine optimization as a benefit to the FAQ section. So every specific question and answer creates an opportunity for your website to rank more prominently for voice searches, as well as the snippets that appear at the top of Google. So by appearing in organic search results, you can build trust, brand recognition, and grow your website traffic. Ultimately, this will reduce your patient acquisition costs and get you more exposure online. So when pulled together, these three tactics work to provide the answers to questions and settle the fears of your prospects as they move forward through their own patient journeys. As you're working through ways to incorporate your buyer persona and patient journey, don't hesitate to reach out to us at Social Speak Network for a complimentary consultation. Our team works closely with marketing directors at healthcare centers to ensure their marketing is reaching the right prospects as they progress through their own journey. We use a combination of techniques from building brand loyalty to capturing lead contact information and systematically converting prospects into patients as we grow your practice's bottom line. So thank you so much for tuning in today. I'm Caitlin McDonald with the Social Speak Network, and I look forward to seeing you on the next episode of the Social Speak Network podcast. Thank you, and I'll talk to you soon.